Good evening, and welcome to the Trent Webinar Advantage Series. My name is Sasha Trivet. I'm the Manager of Recruitment at Trent University. And tonight's topic for our webinar is the Trent Fleming School of Nursing. So I imagine everyone that's tuning in here has applied to our nursing program and is really excited to be coming to Trent. So we're so excited for you to be joining us tonight and ask all your great questions. With me, I have our Dean of Nursing, Dr. Kirsten Woodend, and she's going to be giving us a presentation in a minute or two. It'll be really comprehensive, but you'll also have a chance to ask questions afterward. And we do also have off camera Kathleen Crook. She is our nursing assessor, so she is one of the people that assesses all of the applications that come in and determine whether you will be coming to Trent or not. So we're going to be answering your questions. Before I hand it over to Kirsten, I just wanted you to know that if you wanted to start typing in questions during the presentation, Kathleen will be answering those. She'll be responding. And then after the presentation, we're going to take some live questions. So as you're typing in your questions, Kirsten will be answering them or Kathleen will be answering them. So we'll have a bit of a conversation after the presentation. So without further ado, I'm going to turn it over to Kirsten and the presentation shall begin. Thank you.
So welcome to our webinar. I'm going to walk you through some information about nursing and about the School of Nursing, and hopefully I'll have answered all of your questions before you even get to them, but as my colleague has told you, we welcome questions as we move along. So I'm sure that many of you have already thought about what nursing is, and we debated long and hard, of course, but this isn't a philosophical answer to that question, what is an RN? An RN is someone who has graduated from a nursing baccalaureate program, and that's because in Canada, with the exception of Quebec, a baccalaureate is mandatory for entry to practice as a registered nurse. But in addition, they've also met the provincial requirements to be issued registration. As you'll notice, we call it registration, but in the United States, and sometimes people who don't know about nursing also call it a license, and it is also a license to practice. What kinds of work will you do as a nurse? Even in my career, I have done many, sorry, the slide changing there confused me, but we'll get back on track again. What kinds of work will you do? And even thinking back to my career, I have done many of the things on this list. Traditionally, we think of nurses providing direct care and at the bedside or in public health, but they also provide preventive care in primary care clinics or in public health sector. They could be educators, for instance, on a hospital unit, or, as I am in a university, involved in administration, involved in research, or involved in the making of policy. So you can see that nursing opens many, many doors for your future. There are a huge number of bodies involved in nursing, and this is just a few of the main ones. And so if you've been accepted and over the summer you're really excited to find out more about nursing, you might actually go onto the website and learn more about some of these organizations. So nationally, we have a Canadian Nurses Association, and we also have CASN, the Canadian Association of Schools of Nursing, of which I am the president at the moment. Provincially, we have a voluntary body that advocates for nursing and also creates nursing best practice guidelines. And again, if you want to read more about nursing, going onto their website and looking at those guidelines is interesting, but also a way of pre-studying. The College of Nurses of Ontario is our regulatory body, and they're the body in Ontario with whom we must be registered in order to be able to practice. And ONA is the union, and it represents the vast majority of nurses. All of those who work in hospitals are members of ONA. So, what about nursing as a practice profession and an academic discipline? Now that nursing in almost all provinces, and all provinces but Quebec, sits in a university, we're much more conscious about the idea that we are both a profession but also an academic discipline. And as a profession, we're accountable and responsible to the public for the work that we do. We have a practice
that's based on a specialized body of knowledge. We don't just borrow knowledge from other disciplines. We do that, but we also work from a body of knowledge that's specifically about nurses and is created by nurses. We're bound by a code of ethics, and we provide service to the public, and very importantly, as a regulating. So the College of Nurses of Ontario, our regulatory body, is made up of board members who are elected from nurses in the province. As an academic discipline, that is, as one of the disciplines that sits within a university, we have our own knowledge base. So disciplines are known by the knowledge base that embody those distinctive perspectives that discipline has, in this case nursing. Nursing's theories, methods, our worldviews, and the phenomena that concern us. We are young as a discipline, and while, I mean, we can go right back to Florence Nightingale, for instance, in terms of the generation of nursing knowledge, really the development of a specialized body of nursing knowledge began in the 1950s. And so relative to some other, like geography or geology, for instance, we are fairly young. So what are you going to learn here? Having told you that you're going to become a professional and that you're going to be part of a discipline, there's a whole range of things that you will learn in the nursing school. Anatomy and physiology, microbiology, nutrition. When we're talking about the sciences, we move into the humanities and sociology. You're going to learn about psychology, ethics, communication, teamwork, jurisprudence. And then I've highlighted skills in red because that's what I think most of you probably are thinking about when you come in, that you're going to become a practitioner and do things like give IVs or give needles. And that is a part of what you're learning, but it's not the largest part. The skills are important, but they are just one of the many things that you'll be learning. And very importantly, underpinning and integrating all of the things that you're learning in order to become a safe practitioner, but also a lifelong learning, we will teach you about critical thinking, clinical judgment, and reflective practice, all of which are essential to safe nursing practice. So, I'm sure that many of you have talked to other schools of nursing, and many of them are partnered with colleges. Here at Trent, we have a very unique collaboration. We don't have a 2+2, as you've probably asked about at other schools. We don't have two separate sites. We have one school of nursing, and we're called the Trent Fleming School of Nursing, as you can see on the left side of that slide. And I oversee the faculty that is hired by both Fleming College and Trent University. We are housed in one location on the Trent campus. All of our facilities are on the Trent campus, but you also enjoy all of the benefits of us being partnered with Fleming College. In addition, we have a slightly less integrated partnership with George Brown College, where one of our programs is offered. That's a practical nurse to baccalaureate. And I've got the URL at the bottom, but I don't know that you can type it quickly, but if you just go onto the nursing website at Trent, you will be able to look up our strategic plan. And again, if you're all excited to get going and learning more about our school, that's another document that you can access on our website and read about. So from our plan, one of the things that we did as we developed our strategic directions for the coming years up to 2019 is that we had a look at what we thought we should be into the future. And we see ourselves as the leading Canadian change agent for nursing, as a driver of social justice, that our work improves the health and quality of life for marginalized populations. And we do this through our research, through our clinical partnerships, and through educating clinically excellent graduates. And so if you come into our program, one of the things that you will hear about from your first course in year 1 to your last course in the 4th year is about social justice and our 5 foci which tap into social justice. In terms of our mission, we provide programs that meet the highest standard for nursing education And we foster graduates who develop superior humanistic and scientific caring, professional and social responsibility, and critical inquiry. And I think, again, it's a good moment to reflect on the need for nurses to have a very good grasp, not only of the discipline of nursing, but of science, of humanities, of ethics, etc., and develop a capacity for critical thinking and critical inquiry in order to be safe practitioners into the future. In addition, we collaborate through robust partnerships within the university, but also with many, many partners external to the university. We have one program, one curriculum that leads to a Bachelor of Science in Nursing. At the end of the baccalaureate, regardless of which stream you're in, you will have had the same education. But having said that, there are 3 different entry points to the baccalaureate. The one on the left is the traditional 4-year stream with Fleming College that's all on the Trent site, and I assume that many of you, that will be the program that you're interested in, particularly if you're coming from high school. In the middle column, you'll see that for those of you who are at university and in some cases who have college backgrounds, you can apply to our compressed program, and that is 7 semesters long, and they're contiguous. You go in the summer as well, and so you complete in 2 and a bit years. The third column is our PN to BSCN program, and so that's for students who are registered practical nurses from the 2-year college program who undertake a 1-year bridge with George Brown and then 5 semesters with us at our Toronto site at George Brown College. But again, they all reach the same end point. That is, you graduate and then you need to write the nursing entry to practice exams. The exam since 2015 has been the American Entry to Practice Examination, the NCLEX. This is small and hard to read quickly, but you can also go on the website. You can access the Trent University calendar, which is a good document, another good document to get familiar with before you enter the program. And what I've done, because a question that I frequently get is, when do I do clinical? And you'll see that I've highlighted in red in each semester the course which is a clinical course, so you'll get a sense. So in first semester, you start taking nursing courses. You'll take 2 of them, individual as nurse and nursing as a profession. You'll take 2 science courses, an elective of your choice. But in second semester, you will start clinical practice in a residential setting, and you'll start to spend time in our clinical learning center. In second year, you'll take community and family-focused practice and theory, again, doing more sciences and also taking elective courses. In third year, you're going to start to be exposed. You may have been exposed to hospital practice in second year and family-focused practice, but in third year, you're going to move truly into hospital practice when you study acute care and chronic disease. You will also take a couple of other nursing courses in research and in leadership, more pharmacology, and again, more elective courses. Your final year is another thing that we do differently. That's all independent practice, which you do with a preceptor, and you will do 300 hours in the fall in the independent nursing practice and 300 hours in the winter. Advanced topics are taken online because you could be anywhere doing your independent nursing practice, and again, you'll take electives. So that's the program map for the collaborative program. This is the program map for the compressed program. Again, you can see that there's the same number of clinical experiences, but note that there's a third column here for spring and summer. And students in the compressed program will take clinical in their second year in the spring in a compressed in 6 weeks, and follow that with clinical in the summer, with their final semester being in the fall, 2 years after they've started. So, why would you do nursing at Trent? Well, look at the picture on the left side there with a bunch of professors and staff all dressed up on the first day that our students wear uniforms as sort of a support. And you can see the 2 old-fashioned uniforms that Professor Graham and Dr. Gilmer are wearing sitting at the front. But there are other reasons, and they are many. As I said before, we've got a very strong commitment to the principles of advocacy and social justice. Leading to this, we have focus on health in the context of aging, Indigenous communities, rural health, mental health, and women's health and gender, and you can see how they're all connected to social justice. We have the maximum accreditation that is given by CASN, the accrediting body, for all 3 of our sites, Fleming, Trent, and George Brown, and for all 3 streams of our baccalaureate program. And that is 7-year accreditation, so that's the longest accreditation you can get. There are opportunities to learn and work in other countries. Students who choose to do so in their community placement in 2nd year can do community development work in Honduras during the semester. Students can also apply to do an international placement in their final preceptory placement in 4th year, as long as they've planned that with us a year in advance, because it takes us a while to ensure that we've got a placement that meets our learning outcomes and where you will be safe. We have a 4th year undergraduate thesis option, which is somewhat unusual for a baccalaureate program. And this is one of our students at our George Brown site who just last week defended her undergraduate thesis. If you do that, you do it instead of taking 2 advanced topics. And you can see that she's, at the end of her presentation, she's added some words of wisdom for students who are choosing in the future to do their undergraduate thesis. And her work was on food security in the trans population in Toronto. A really, really good bit of work that she did. We have very engaged faculty. Professors are closely engaged with students in teaching and clinical, and on the right you can see Dr. Gilmer and Dr. Thibault, and below Professor Buck McFadden working with students. Our professors are also engaged with research programs in the area of aging, ethics and leadership, as well as interdisciplinary research in environment, Indigenous peoples, chronic disease, and women's health. I myself am doing research in chronic disease self-management at the moment. We have very active student nursing associations, of which you can be a member. In fact, you will be encouraged to be a member from your 1st year. And the student association, the TFNSA, works with us to populate our school committees with students. So you can also sit on some of our committees to help us, such as policy. We also have a chapter of the Canadian Nursing Students Association on the campus. And we have a Facebook page, and you can access that as well. That's public. Have a look at some of the events that have been undertaken by the committee this year. We have a state-of-the-art clinical learning center, which we continue to expand. We've added 2 new spaces to it this year. And here you can see some of our 1st year students in their nursing uniforms in our clinical learning center. We are increasingly using simulation as a form of learning, and our students give us very positive feedback on how that has helped prepare them for practice. There's lots of support in the school. On the middle picture there, you can see Cheryl, who is our non-academic requirement coordinator. She will be meeting with you during the summer during orientation to make sure that you are ready with your non-academic requirements. She'll also meet with all of you in person in the 1st month of school. Placement and career decisions can be supported by Anita, our placement coordinator, and Shelley at our George Brown site. I didn't get a picture of her there. And we have our own academic advisor, in addition to the advisors that sit within each of the colleges at Trent. And so you actually have 2 sets of academic advising within the school and academic advising within the university. In addition, we have a taxi pass program for students who don't have transportation in our clinical courses where there are groups. You can apply for a taxi pass, and we do all the work of arranging it, and we pay half the cost of it. You pay half and we pay half. A very important thing is that some students will receive alternative offers. Applications to the Trent Fleming School of Nursing are extremely competitive. Our numbers continue to rise. So inevitably, some of you will receive an alternate offer. Read what you receive from so that you are sure that you understand what it is that you are being offered. What you can do if you receive an alternate offer and you accept your admission to Trent but not to nursing, is apply for transfer after 1 year, either to the compressed or the collaborative program. Usually those that do 2 years can then apply to come into the compressed program, and it takes another 2 years and 1 semester to complete. You do need to remember that competitive admission nursing program, despite being in a Trent program, is still competitive, and so marks are important. One thing to keep in mind when you choose your courses in the first year, if you accept an alternate offer, is to both choose courses that help you build a future in case you don't get into nursing, but also courses that interest you. And I say that because if you are interested and engaged in the course, your chances of getting good marks are higher, and getting good marks is a very important part of being able to transfer to nursing if you've accepted an alternate offer and are here already. Just going back to the fact that one of the things that we are going to teach you here is critical thinking, clinical judgment, and reflective practice in order to produce that nurse of the future that is going to change the way healthcare is given or delivered in Canada. And that's Albert Einstein saying education is not the learning of facts, but it's training the mind to think. And now I'm ready to respond to any questions that you might have.
Thank you, Kirsten. That was very comprehensive, and I imagine that answered lots of questions. But we do still have a few questions that have come in while you were speaking, and a couple of them surrounded placements and elective credits. So with regard to placement questions, Justine wonders, do you have to take the placements that do they have to fall within the 5 areas of study that you mentioned? Or if students wanted something outside of those areas, how would that placement work or not?
So there are 5 foci, and we like placements to be aligned with foci, but that's not always possible. And so what you do in each year is your placement. So in first year, you have no choice, but your placement is in residential care. It's in long-term care. In second year, you do a placement either in community health, but let's say you're interested in women and gender, you actually have an option before the semester to put in what you want to be in. So you will be given a survey and you can make some choices. Obviously, we can't promise that we'll get you in that choice, and if you want to try to align your placements with the 5 foci, you can, but it doesn't always work and it's not mandatory.
Okay, great, thank you. And also a question about elective credits. So can elective credits be in anything, or do they have to be in science and nursing?
No, elective credits can be in anything, and part of that is, let's go back to Einstein. It all is about broadening, it's about changing the way you think, it's about opening your mind. I mean, it would be unfortunate if university was about making you the same person you started at the beginning. Yeah. And so what we want you to do is explore. It is optimal from our perspective if you align your electives with the 5 foci, but it's certainly not mandatory.
Okay. And then with the Honduras piece that you mentioned, are interested in that. And so how do students pay for the, going to Honduras and living there and accommodations and all?
So you will pay your normal tuition because it's a course like any other course. But in addition, and I don't know what the cost would be by the time this group of students meets second year, but you have to pay so it's all arranged and you pay in a bundle. And so you have to pay for your transportation, for your accommodation, and for your food. But it's all arranged in advance. And you are told in advance what that cost will be.
Okay. Perfect, thank you. And you mentioned that lots of nursing professors are doing their own research, including yourself. Is there any opportunity for students to be involved in the research that the faculty are doing?
Yes, and so we increasingly hire research assistants. I actually have a research assistant at the moment who's in first year, and he's working with me, and as we're working with one of the rural communities here to develop a chronic disease self-management clinic, one of the objectives in our school strategic plan. We've had students work with Dr. McIntosh, for instance, in her research trying to remember which one they worked with. I think they've worked with her on some of her breastfeeding research.
Okay.
So there are a number of opportunities for students to become research assistants. But the other way too is if students are interested in research is to choose to do a thesis in their 4th year, and then they work very closely with a faculty member, and usually you choose the faculty member because of the research they're doing, and so your research is aligned with theirs.
Okay, perfect. Thank you very much. I think I'm going to turn the focus to Kathleen for a moment and just ask, there are, finish typing, go right ahead. There are a number of questions. People are wanting to know if all the offers have gone out, who's gotten an offer, who hasn't. Can you just give us a lay of the land of where we're at right now and what students should be expecting to hear if they haven't already?
Yeah, so students should know that we started admitting in mid-February, and we admit on a rolling basis. So offers continue to go out weekly or bi-weekly as we monitor our numbers. As one student already asked, we are a capped program, so we have 120 spaces for our collaborative and 80 spaces for our compressed. So we closely monitor those numbers as we admit, and this process can actually take until June to wrap up. So the latest anyone would hear from us would be in June.
Thank you. Hopefully that kind of allays everyone's fear for any of you who haven't yet heard. I know it's a tense time, and hang in there. You'll hear soon enough. Emily has a question about clinical placements. Is it a group of students that are together with one nursing instructor, or is it one-on-one? How does it work?
It varies over the program. So the first placement that's in long-term care, that's a group of 6 to 8 students with a clinical instructor that's on site. In community, those are groups of 2 to 3 students that go out with a preceptor in the community with one clinical instructor who oversees about 20 students. In the family nursing, which is child mental health, then again, you're going out with a group of 6 to 8 students with one clinical instructor who's on site with you. In 3rd year, the acute and the chronic, both of those placements, you're in groups of 6 to 8 students with a clinical instructor on site. In 4th year, you're in semi-independent practice, and so I don't know how many of you know what a preceptor is, but a preceptor is a nurse who's actually working in I'm going to say institution, but it's not always institution. It could be a street nurse, for instance. It could be a public health nurse. It could be a nurse on a unit in a hospital, and you will have been completed a survey at the end of 3rd year saying where you would like to do your placements in 4th year, both geographically and in the terms of the kind of nursing you want to do. And again, we'll try to match it. We don't always get it perfect because it's hard to get clinical placements. And then you will go out to wherever that is. Let's say you're at Rouge Valley Hospital and you're on a surgical ward with Mary, and you will do your 300 hours following Mary's shifts at that facility. But there will be a clinical teacher at Trent who will check in on you and Mary and make sure that everything is going okay over the term. And as I was mentioning, that preceptor could be anywhere. They could actually be in administration in a hospital. They could be a nurse policy advisor in government. They could be a street nurse in Vancouver. It could be a primary care nurse in a VON 316 clinic in Peterborough. So there's a range of options for where you can do your placements in 4th year.
Okay, well, sounds like lots of options there for students. There were a couple questions earlier about uniforms. What do the nursing students wear? I know we saw lots in the pictures, and how do they work? Do they buy them up front, or?
So we only moved to uniforms a year ago, and there's been a lot of discussion, but this is not something that we as professors or as a school have mandated. This was actually a project by our students who did some research, looked at the literature, and went out and looked at what other schools had adopted and decided that what patients preferred and what they would look most professional in is a uniform with black pants and a white top. And you could see from the pictures that the logo is on it, and students wear year badges so that when you're on a floor or wherever you are, it's really obvious which year you're in, which means that people will support you in the way you need and not expect things of you that are inappropriate. So this was chosen by our students. During orientation, we will make sure that we have the company that supplies them come and link up with you. Last year, we had a little difficulty when people wanted to try things on finding some space, but we've expanded some of our nursing space, and we've now got it figured out exactly where we can do the uniform try-ons and ordering. So we will make sure that you have easy access to that at the beginning of semester. And you actually wear your uniforms in first semester, by the way. While you're really going into clinical in second semester, we do give you a chance to be introduced to the labs in first semester. And so there is an occasion in first semester where you get to don your uniforms, which we as a whole school celebrates. So.
Wonderful, thank you. And then just some questions about the NCLEX. Do we have a pass rate, or how do we rank, and what can students expect there?
Good debate. And I don't know how many of you have been following the whole NCLEX story, and it is confusing. Pass rates for first writing of the entry to practice exam have fallen significantly since the implementation of the NCLEX in January 2015. And so you're going to see that the Ontario rates are sitting about 67% pass rate. The college, the regulatory body, has introduced a new number which they call the ultimate pass rate. And that is the pass rate after everybody wrote all the times they could write, up to 3 in 2015, and that pass rate's now at 83.7%, as I recall. The pass rate for the Trent Fleming School of Nursing is slightly above the provincial average. And we are constantly implementing new programs to try to improve our NCLEX pass rate. Unfortunately, part of what happens, and particularly in the collaborative program, is our students were in the second year of that program when it was announced that there would be a change in examination, and so they didn't get the benefit of our having changed the way we do midterms and final exams and so on to improve students' readiness for the NCLEX.
Thank you, Kirsten. I'm just going to address, there's a few questions about scholarships, so I'm just going to address that. Basically, your scholarship is based on your final grades, so we are going to be looking for those. If you raise your average up at the end, we're going to give you that scholarship, and if it drops down and you've already received a guarantee, then we will honor that guarantee. So if you're coming to Trent with 90% or higher on your top 6, including your nursing required courses, you are looking at full tuition, and 85 and higher, you're looking at $1,500. So there's lots of great money to be had for good scholars, and Trent certainly rewards you well for all of that. And then there was another question about orientation, and I'll just address that before I turn it back to Kirsten for other questions. Orientation happens over the summer, and it's for all students, so you will be mixed in with other students, not just nursing students, but there are a variety of different dates that will come to you once you accept your offer. So when you accept your offer, you will be receiving information, and you will be invited to attend. Is there a nursing date specifically?
I think so, that one in June, one on half days in July and August.
Oh, my mistake. Okay,
Sorry,
so
for
it sounds like there is an orientation
well, this
for
one
nursing.
We will have, yeah, and all the students will receive an email about it. So we'll
Okay.
reach out to them about that. And then also, just while we're talking about summer, we're going to have lab tours for all of May. So that'll
Awesome.
be good if they can come out for that.
Okay, so lab tours, how does that happen for May then? It'll just be as part of the campus tour then, or?
Yep. So we did just have a question from Caitlin asking about the nursing specific tours. So how that works is you would come to Trent, you do a regular campus tour, and at the end, our enrollment advisor, Karen Foster, will meet all of the nursing students, and we take a little visit up to the labs, and you actually get to see all of the lab space. And I think right now we're working on 2 days. 2 days a week for May, and then sort of sporadically after that. If you go to the tours website, trentu.ca/tours, all the nursing days will be marked off once we've confirmed all our dates. So you will have a chance to register for the nursing specific days.
Okay. Kirsten, there's a question about, would you like to go ahead and field that one?
Okay, I've got a question here about specializations in nursing. And there are no specializations in undergrad. So you'll notice that I've used the word foci for our 5 foci. But CASN, the Canadian Association of Schools of Nursing, in its baccalaureate position statement is quite specific that the baccalaureate is a generalist degree. And so we prepare generalist nurses. You do, in our program, have the opportunity, if you take the correct course and have a sufficient average, to actually do a placement in very high acuity, such as ICU or emerge, but that's not a specialization. What usually happens is that after you graduate, you can then take extra courses and specialize. So for instance, after I graduated from nursing, I did a critical care certification at a college. So that's one of the options you have, or you can specialize through master's preparation as well.
Thank you. We have a question from Stephanie. She says she has her DEC from Quebec and wondering if she can receive any transfer credits. Stephanie, can you be a little bit more specific about your DEC? We're a little unsure what you mean, but we'd be happy to answer. If you can explain what the DEC is, we'll answer that for you.
All right. I'll keep an eye out for that.
In the meantime,
we have one question. Well, we've had a couple about the non-academic requirements. So if Kirsten, if you wanted to elaborate a bit, and for everyone else, I'll just include the link to our forms page. All the non-academic requirements are listed on the website, and there is a form there for students who've received the offer that they can start on that now. But yeah, Kirsten, if you want to talk a little bit about it.
You may not want to start too early at meeting the non-academic requirements because some of them only last for a year. And so you need to think about the timing of them. If you do them now, you're going to need them next May, for instance, or next April. And so I wouldn't be in a hurry to get them met too early. The other thing is that when you come into the school, we will help you with some of them. So for instance, police checks. If you're living in residence, you have a local address. We'll actually bring the police into the building, not to arrest you, but rather to help you get your police checks done. So you just have to line up in the hallway and deal with that here. We offer CPR courses in terms of mass fit testing. We do that on site. Things like your vaccinations, that's good to check out if you want to do that through your family physician. But the nurse we have that does NARS can also draw blood if necessary in order to have blood titers done for the various requirements there. And she also runs vaccination clinics and can do TB tests. So you may prefer to have some of this done with your own practitioner in your own town, but I wouldn't worry a lot about making sure that it's all completed over the summer. Just refer to the materials that you're sent in terms of preparing yourself. And as I say, don't get everything done too early.
okay, Stephanie, Kathleen's going to respond to your question there about your collegial diploma in psychology. And in the meantime, Kirsten, can you tell us what were the classes like? Is it set up like a lecture style, or what can students expect?
Well, Trent and the Trent Fleming School of Nursing both really believe in a small class approach, but obviously we have to be realistic. We've got a large number of students. So what we do is for every time we have a class that has a large number of students in it, we also have within that course seminar time. So let's say, for instance, NURS 1000, sorry, I was working on courses today that were pre-2009, only 3 digits. So let's say you're taking NURS 1000, you will be mixed in collaborative and compressed students, so there'll be about 210, 220 students in your class. You will have 2 hours of lecture each week with that large class size, and then you will have 1 hour each week in groups of 20 to 24 students with a professor so that you get closer contact time.
All right. And do we have any graduate employment rates for our nursing program? Any stats?
You wanted to give them? They're high. They're very high.
Awesome.
And it's interesting because you're
Very high.
hearing things about changes in staff mixes in places like Windsor and layoffs of our end. But I was just working on a grant proposal yesterday, and because the average age of nurses is quite high, the actual number of nurses that are registered is going down, and we're hearing more and more concerns about nursing shortages. So I think for the future we can expect that employment will remain high.
Great. That's awesome news. For any of you who are considering living in residence, it is a $30 fee to apply to live in residence, and that guarantees you a spot. So you will want to do that before the deadline. If you're concerned about whether you're going to receive an offer for the nursing program or not, and you don't want to apply for residence before you hear, it would only be the $30 that you would need to pay up front. And if it turns out that you do not receive an offer or you decide to go to a different institution, it's only the $30 that you would lose. So I think it's worth it to pay that up front just to secure yourself a spot in residence. After that, there will be other deadlines for more payment, but really upfront, it's only a $30 fee, and that guarantees you a space as a first-year student at Trent, so it's probably worth it.
So Logan has asked whether once graduated, is she able to join the nurse practitioner program at Trent, and is it affiliated with Queen's? So in order to be accepted into the nurse practitioner program, you need to have approximately 2 years of practice. So you would graduate from the baccalaureate program and go out and work for 2 years. But then, yes, you can do the nurse practitioner program at the Trent site. And it is actually a Queen's degree that you would receive at the end. So we've been offering a satellite of the nurse practitioner program here for about, but as of next year, we'll also be teaching, it's a master's nurse practitioner, we'll also be teaching the master's courses for that program here at Trent University.
Okay, great. And Kirsten, just in response to your question about will you hear one of 3 responses, acceptance, an alternate, or rejection? Yes, we will definitely be in touch with you. Either way, whatever we're going to do, you'll receive something. Allison, can you talk about the nursing learning living community?
And that's at Otonabee College, and it was launched by one of our professors, Dr. Jane Mackey, who was the head of college at that time. And they have presentations. It's an opportunity for nursing students, usually at Otonabee, to get together and share experiences. Do you have more information on it, Carly, that you want to add?
No, anything that I know is, yeah, it's just in Otonabee College. They can specify that they want it on their application. And sort of the main purpose of it is so that nursing students can be in the same residence house with other nursing students. What I've heard from current students, I mean, the benefits are that you're with students who have the same demands of the program, so everyone has kind of the same deadline, same time to hit the book. So there are definitely benefits to it. However, it's not mandatory. So if you really have your heart set on a different college, that's certainly fine.
Omarla, we're just going to pull up the housing application website for you. It is quite a comprehensive application, so you're going to want to put in lots of information, and you'll probably pay by credit card when you're there. We're just looking for that link for you, and we'll post it when we have it. Okay, what else do we have here? Applicants to the compressed program, can they be offered a 4-year nursing option?
Yes. Yeah. So if an applicant has applied to the compressed program, but due to transfer credits or something is not eligible, or if that program is filled and they've applied at a time when it's filled, we will assess them for the collaborative. So that would be another alternate option. Also, just while it's on the table, if a student has applied to collaborative but has the transfer credits for compressed, we can also extend an offer for that as well. So we do a pretty comprehensive assessment. We do look through all of your documents and do everything we can to make sure that you're aware of all your options at Trent.
Eileen, does that answer your question about compressed and the collaborative program? Everyone understands the collaborative program is the 4 years, and the compressed you have to bring transfer credit from another institution in order to qualify. Hopefully everyone's good there. Okay, what else do we have? Where do you get the uniforms and when does course registration start? I'll do the course registration and you can talk about
We'll do the uniforms.
So course registration usually opens mid to late June for students in their first year. So no panic, you have lots of time. And as part of the orientation throughout the summer, if you want to actually register for your courses while you're at the orientation session, you will have access to academic advisors and staff to help you register for your courses at that point. So don't panic if you try to do it online and it's just not super easy for you. You're struggling in any way, because you can do that when you come for one of the summer orientation sessions.
And for uniforms, we'll be bringing the company person on site when you do your mandatory orientation at the beginning of September, after, well, just before classes start. And you will have a chance to try them on and pick your sizes and place your orders then. We may also make some of that available during orientation during the summer, but I can't promise that. But for sure, we'll be doing it in September when you come to mandatory orientation.
Okay, great. And for students wondering when you're going to have to make some of your first payments, if you're going to be living in residence, you will have to make a residence deposit of, I believe it's $500 at the beginning of June. So that's on the deadline, June 3rd. And then you'll have your first tuition deposit of $600 on the 15th of June. So those are the two pieces up front that you need to be ready for. And that information will come to you as well in our, so we're going to be sending out some next steps, welcome packages in the next few weeks as well. So that information will live there. Okay.
Oh, this is a good question from Marianne. If we're ever away during the summer, would it be bad if we missed an orientation date? This is a really good time to tackle that question so that you can plan well. You need to check the university calendar for the dates of the start of semester and the end of semester, because if you miss an orientation, you are deregistered from the clinical courses. They're very important. They're mandatory. And so I don't mean, and if it's talking about orientation to a clinical course, I need to be careful about that. If it's mandatory orientation in September, but we like you to be there. We occasionally have people who miss it. The summer orientations, we do have a number of students who don't attend, and just contact us and we'll make sure you get the information you need.
Okay, so just to clarify,
there are different kinds of orientations.
Yeah, there are different kinds. So just to clarify, the new student orientation in the summer, if by any chance, you know, you're away traveling or something and you miss it, there are ways you can certainly register for courses online, and there are helps online with the new student orientation group. But it's the September orientations that you must attend that Kirsten is referring to.
And it's mandatory, but again, it's not the end of the world, but you're going to all be here and be excited anyways, because it's just a day or two before classes start. And then orientations, my concern when you said you'd be away for the summer is from then on, you need to be very, very careful about making sure you know about dates, because we have orientations every semester just before clinical, and those orientations are mandatory, such that if you put a holiday on it, you don't get back on time, you don't go into clinical. So.
Okay. And students are wondering if they could do elective courses in the upcoming summer.
Well, that's a question that I'm going to have to
That's a good question, Kathleen. Do we know if students could be doing elective courses over the summer before they, start in September?
Well, if they wanted to do it before September, they would definitely just need to reach out to us first. You would have to amend your application on OUAC. So you would actually have to add a summer application to attend as a part-time student in the summer. It can be a little complicated, but it's not impossible. So if you are interested in that option, you can send an email to nursingadmissions@trentu.ca, and I'll put that in the Q&A box as well. And that way I can get back to you with a bit more detail.
And Caitlin, with regard to the residence piece, we do have a few pictures online of the residences. The best way to know which one you'd like to live in our opinion, is to come for a tour. So if you haven't already been for a tour or an event, it would be great to come and visit and check them all out. And if you've already selected your first choice and you wanted to change your registration, I think it would be fine. I think you would just want to send a quick email to residents@trentu.ca, and they might be able to help you with changing your application, which residence is your first choice and which is your second choice.
We have a question about whether you have to pay for the uniform or if it's part of the tuition. Yes, you do need to pay for the uniform.
Okay.
They're cheap, by the way. They're not expensive. We were very, very careful in making the choice to ensure that they were not expensive uniforms.
That's good. So Hong has a question about doing a double degree, like computer science and nursing at the same time. Is that possible?
Well, it might take you 5 years. It would depend on what the requirements for computer science were. There's absolutely no question that you couldn't do it within the normal 20 credits. And my guess is that computer science would be intensive enough that you probably needed to take 5 years to do the both of them together.
Yeah, I think that would be a tough go. So Carly has a question about transfer credits. And Kathleen, my understanding is transfer credits are listed at the portal. So students are assigned their transfer credits and they'll know exactly what's there.
Yeah, so when we send an offer, we'll do an initial assessment. So that would be based on what is currently in our database as equivalent, as well as the courses that that student has already completed. So you would see sort of a rough first draft of your transfer credits when you're given your offer. If you log into the My Trent portal, under the Academics tab, you can see with admissions information a transfer credit icon. That will show you what your previous course was listed as, and then it will show your Trent course. And what you're looking at is actually your academic record. So, so those courses are on your academic record. However, until we receive your final transcript, they can be subject to change. So if your final transcript has more relevant transfer credits towards nursing, we may move some of those around. Students are eligible for a maximum of 10 transfer credits, which for nursing, that might mean you have a few extra that aren't actually applicable to the degree, just because the courses you'll be taking are so specific. So the main benefit there really is just when you get to register. The priority registration period is based on credits. So for our compressed students, because they are completing at a quicker pace, they may be able to register a couple days before, just depending on transfer credits.
I'm going to answer some questions about textbooks. That is, how frequently do they change and what's the best way to get them? I would not get enthusiastic and buy textbooks over the summer if that's what you have in mind. Our course outlines are not usually approved until the end of August, and textbooks could change right up until the course outlines are approved. We also go into curriculum meetings in June, at which time we debate which textbooks are being used over the coming year. So I do not recommend that you go out and buy used textbooks. We will, in the September orientation, talk to you about the textbooks. When you get into your classes, you will have course outlines and you'll see what textbooks are required. So it's better to wait till the fall. I think if you're anxious to get into textbooks, I know some students are ahead of time, what I really recommend is that you do things like learn more about the other nursing organizations. We are making the student handbook publicly available. I believe we've already done that. So you can go on and read that. You can get familiar with the university calendar, etc. There's lots of stuff you can do ahead of time, but I would wait for textbooks. The other thing is about uniforms. Do you have to wear them all the time? You only wear them in the clinical learning center, that's in the learning labs, and in your clinical placements. And in community, you actually don't wear them in a community placement. You wear them in the more hospital-based placements. There's also a question about whether Honduras is the only study abroad option, and it is the only option in second year if you want to do your community placement out of country, but you can do study abroad as your placement in your final semester of the 4,000 level. I mix between fourth year, but for a compressed student it's not fourth year, but in your final 300-hour clinical placement. But you need to let us know a year in advance that you want to do an international placement, because it takes us a year to organize that placement.
Olivia has a great question, Kirsten, for you about, don't get into the nursing program. What opportunities?
Okay. And there are some, it's not a degree in health studies, but there's sort of a specialization in health studies that's being developed here at Trent. And even without that, Trent had health long before it had nursing. It had health and social justice. And so if those are things that excite you, and if that's part of the reason why you're looking at nursing, I would suggest that it's very, very easy at Trent to put a set of courses together. So I've mapped it so that you could do a 4-year degree and with a health bent, and have a focus on aging, a focus on health administration, on Indigenous health. There are many options that you can build. And that's why I was saying, if you do get an alternate offer, is not just to think about how you're going to spend a year here and then apply to nursing and that's all there is in the world. Think about the courses you choose in terms of what does that build for you as a future if you don't get into nursing. And as I say, also pick courses that get you excited, because you get higher marks if you're excited.
That's true. Caitlin has a question about living and being in a community with other nurses. So just so everyone's clear, we don't have one residence that's dedicated to nurses only. So all our buildings, we have 4 residences that are on campus, and then we have one residence that is just across the street from campus and is considered somewhat of an on-campus residence, has the same amenities as if you lived on campus. We have nursing students living in all those buildings. So you're mixed in with all different types of student. We like the idea of a community where you'll get to know people from a broad range of spectrums and disciplines and different backgrounds and interests. So we don't encourage any one program to live together in a building. So you choose your residence based on, what the rooms are like, or if you wanted to live in a specific building, or you wanted to be on one side of the campus or proximity to the gym or to the library or whatever. You have lots of other ways to choose your building. You won't necessarily choose it because that's where all the nurses live. They're spread out amongst all the buildings.
We have a question about 1050 and 1051. If you already have credits for those courses with at least 60%, then you don't have to repeat them when you're in the nursing program. We also have a question from Caitlin about, in the community placements, are you able to do one in your hometown if you live close enough to campus? And that depends on the course. So not for your residential placement in first year. We use residences in the Peterborough and surrounding areas. In second year, community, there's a range of placements. They might go down as far as Oshawa and, for instance, Coburg, but it would be highly unlikely, for instance, there would be placements in Toronto. So no, again, there's only a certain range. Those could be in Lindsay, they could be in Peterborough, and it could also be in Oshawa, but that's the limit for those. In third year, again, we will use facilities primarily in Peterborough, Lindsay, the Ross Memorial, Coburg, NHH Hospital, and occasionally Oshawa. For fourth year, in areas considered anywhere to the west side of Toronto and to Kingston and to north of the lakes, north of Peterborough. And so you can choose to be anywhere there in your fourth year placements. If your average is sufficiently high, and we have had no concerns about your practice in previous courses, you can actually choose to do your placement in fourth year anywhere in Canada.
Great. Well, I think we've kind of caught up to the questions that have been posed. Does anyone have a question that maybe we missed because there have been a lot, or a question that is still unanswered? Now is your last chance.
There is a Trent Fleming Nursing Student Association Facebook page, but there is also a Twitter feed, and the address for it is at TF_nursing. And so we tweet out practice NCLEX questions and information related to our 5 foci and social justice in general on the Twitter feed.
Okay, and one more question about scholarships. Unless you're applying for the prestigious scholarships, which the deadline has already passed, you don't have to apply for the automatic scholarship. Those ones are just based on your final grades, and we automatically award those to students coming in with an average of 80% or higher, and then it's going up depending on your average. So don't worry about applying for those scholarships. And the deadline for the prestigious has already passed, unfortunately. But for the regular, don't worry, we're going to automatically award it.
We also have scholarships and bursaries once they're in the nursing program for which they can apply each year, but that will occur sometime after you start the program. So.
Yes. And so Jean has a question about an offer of admission coming after the deadline for the residence payment. No, you would hear before that deadline. So I think it's the 1st of June would be the absolute latest that you would hear, if not earlier. And then you would have to secure by June 3rd your spot in residence. So, but as I mentioned earlier, there is no harm in applying for residence now. It is only a $30 fee to do that. You don't have to lay down any more money than that. And if in the end of the day you decided not to come to Trent or you didn't receive an offer of admission, all you've lost is $30. So you might want to do that just to kind of get your name on the list so you have a better chance of getting your first choice in residence.
I'm sort of responding to one student.
What are the main things that differentiate Trent from other nursing programs? Well, one is the option that you have to study abroad in second year, and in 4th year, a thesis in the 4th year. The social justice bent being so strong in the program is another one. Both of the final year placements are preceptored, which is again different from other schools of nursing. That's just a few of the things that are different here.
And from Caitlin, if you're receiving full tuition scholarship, how likely are you able to renew it each year? I think that very much depends on the student. We don't really keep stats on who renews and who doesn't, but you do need to maintain the 90 to renew your full tuition scholarship. And yes, university is harder than high school, so you do have to work hard, and the nursing program is especially,
nursing program's very hard.
Yeah, it's a hard program, so please come prepared to work really hard. But students do it. Students maintain that average and keep their full tuition scholarship. So yes, it is possible.
We don't maintain a waiting list. There's a question from somebody about whether there is a waiting list, and we do not maintain a waiting list. I'm looking at the advisor here to make sure I'm correct.
Yeah.
No waiting list.
Okay. So I think we've pretty well answered the majority of the questions that are here. And I would just like to say thank you so much for joining us this evening. I hope you found it informative. You've had lots of amazing questions. We've all struggled to keep up with the questions. And if you do have more, please feel free. Admissions, nursing admissions at trentu.ca, and Kathleen will be fielding those questions, and she'll have all the great answers for you. We do have opportunities for campus tours coming up. We run those daily and a lot of Saturdays as well. So if you haven't been to campus, please come and visit. We're also offering Explore Days. So we have an Explore Day that's science-based, May 13th. It's a Friday, and we will have nursing labs on display. You can see a chemistry lab, you can see a bio lab. So all your first year labs, you'll be able to have a look at those buildings. You'll be able to sit in on a couple of mini lectures. Are you offering
one of which I'm giving?
Yes, Kirsten's offering a mini lecture too, so you can come and meet Kirsten and hear from her once again. We have other webinars coming up. There is one on study abroad. There's going to be a financial aid webinar, which might interest you as well. So please do tune in again. And we thank you for joining us. Have a great evening.
Thank you for joining us. And I hope to see you at
one of the orientations or open houses in the future.
Take care. Bye-bye.